So before we jump into the full meeting, I just wanted to let people know that Julie Sorensen and Jennifer Lincoln cannot join us today. So John Huber and myself will be leading the meeting, but you're all old hands at this. So all we get to do is really introduce these wonderful people. And speaking of introductions, I thought just while we're in the very beginning here, we could take a couple minutes for anyone who's either new to their position like Dylan, and anyone else who may feel they don't know this group very well. If you want to just use the raise your hand or unmute yourself and just quickly say your name and where you are so people have a sense of who to reach out to. One of the purposes of this group is to connect people, across out of our geographic ranges and just make sure everyone knows of other people and what they're doing. And so Dylan, can I just start with you, since I know you're new to your position, and you could just say who and where you are. We'll keep these really brief so we can keep going and get right into our presentation. But it just struck me a few people might want to say who they are and let the rest of the group know where they are.
Yeah, no problem. Yeah, my name is Dylan Buchanan. I just started with Fish Safe Nova Scotia as an executive director. I came to Fish Safe from the Scotia Fund Day Observer Program. So I have a background working in fisheries. And like I say, this is only my third day, so I'm just really learning the ropes and excited to be a part of this.
Well, welcome. Thank you for joining us. Anybody else want to say who or where they are if they feel like they might not know the rest of the gang? Kimberly, I think it would be good if you introduce yourself.
Perfect. Thank you, Becca. I appreciate you giving the time for me to introduce myself. So I'm Kim. I'm with the Northeast Center. I've been working here for a little over a month now, which is great. But I am the research coordinator. So I see some familiar faces on here, but some of you I don't know. So I look forward to working with everyone and being on these meetings.
Anyone else want to raise their hand just quickly? Lily, yes.
No, I was just saying hi to Kim.
Oh.
Hi,
Kim. Okay, I see Kay Loans here. Raise your hand. Go ahead.
Hi, Keith Loans here. I'm secretary on Fish Safe Nova Scotia on the executive. I also work for Clearwater Seafoods. We run an offshore fleet, a little bit somewhat globally, of 21 offshore vessels. So very, very excited to be joining in. One, to learn and help and support Fish Safe Nova Scotia, as well as our own fleets as well, through learnings and hopefully through some shared experiences. So this is all things near and dear to our hearts, is looking after our crews and our guys that go to sea and are in the living sea and doing what we can to keep them safe and make life better for them. So very excited to be here. Thank you.
Thank you. Glad you could join us. Anybody else? Everyone else feel like they're known? Okay. Well, we'll keep doing this in our upcoming meetings. So if you're too shy today to say anything, you can do so another time. But good for everyone to start putting names with faces here more and more. And speaking of which, I did a shout out for speakers, and we've got some wonderful ideas coming up for upcoming talks. But as you know, this is quarterly, and we always want to stay a good jump ahead of it. So I'd love more names and more ideas, even if it's just topic ideas you'd really like to have covered. I know one topic that's come up a few times is personal locating beacons, and we may just do an open session on that to, get people's thoughts on what's out there and what's happening. But if anyone has a thought or wants to speak, please do send me a note, and just bear in mind, this does not have to be some complete research project or publication or anything grand. It really can be just something you're working on with your particular fisheries. That's what this group is for, is to share questions, ideas, new work, things that may never see the research light of day. That's what this can be useful for. So please do reach out, send me thoughts. And I do want to remind people to mute. I'm hearing a little bit of feedback. So make sure you're muted unless you're going to speak. Dylan, that may be yours that I'm hearing chirping there.
Oh.
Mute it. And then I just wanted to, before we jump into our meeting, I wanted to see if John Huber could share his screen and talk to us about updates on IFISH.
Do you see it?
Perfect. Thank
All
you,
right.
John.
Great. And I just saw that Casey jumped on too, so she can definitely speak to this as well. But IFISH 6 is January 8th through 12th, 2024. And it'll be in Rome, Italy at the headquarters of FAO, the Food and Agricultural Organization of the United Nations. We're very excited. There should be some call for abstracts coming either tomorrow or Friday, depending on how fast I can get the website updated and everything said about having ideas for this group. If you've got a proposal that you'd like to put forth for IFISH, we'd love to receive it. If you haven't followed the social media, there's a Twitter feed and there is a Facebook account, and then it's ifishconference.ca, since our last one was in check out the website and we can add that information to the meeting notes from today as well. But we hope that if you have interest in it and the ability to attend, that you'll consider doing so.
Thank you, John. And John, maybe if you could throw those links into the chat for anyone who wants those now.
Absolutely.
Great. And does anyone have questions for either John or Casey on the IFISH 6? We have just a couple minutes now if you'd like to ask anything.
Not all at once, please slow down.
I'm sure you'll have them in the future. Well, you know where to find all of us. So that's great. And let me just share the agenda here briefly.
I just have a question, John. Can you give me like a sell sheet so I can ask Mustang Survival to pay for me to go? Rome, Italy, that would so suck as a business trip.
Sure.
There you go, Lily. I think you need to be there. You have a
Yeah.
lot to offer.
Actually, do you have time for me to just make a little save the date announcement too?
Sure.
So because of my work with Mustang Survival, and I'm the person who works with nonprofits and industry groups, that's one of my jobs. And I've just been asked to join and joined the Canadian Safe Boating Council. I'm the first American to be part of the board of directors, which is pretty cool. I just got inducted 2 weeks ago in Toronto at their board meeting. They have a symposium every year, and this September it is going to be in St. John's. So if people want some information about that symposium, email me. I'm on the email list for this group, and I can send you some information. But it's going to be in St. John's, Newfoundland, and Canadian Safe Boating Council. That's it. Oh, the dates. The date of it. Sorry, I really wasn't prepared to do this, but
Lily, why don't you pop that in the chat? And
I
see
will.
that-
September 26th to 28th.
Perfect. Thank you. And Casey,
Okay.
I see you've got something to add. Jump in.
Sure, I'm going to keep my camera off because I am also having a rural broadband day. So I will, but I wanted to thank you for talking about IFISH. We have a couple of really, it's really too soon to announce the kind of the structure of the conference. However, to your point, we're working on looking at not just conference papers, but also workshops where people are inking out issues and looking at innovations and, actually looking at solutions like PFDs and things like that. So stay tuned, and there'll be much more coming. We do also for your folks, we do not anticipate a registration fee this time. So which is good. So we're looking for we're hoping to keep costs low. And so I'm just really excited. And for St. John's, Newfoundland, that's where we had IFISH 5. So it's a great place to it's a great place to go for those sorts of things. So thank you very much, and just stay tuned, everybody. We're gonna have much more coming.
Perfect. Thank you, Casey. That was great. And just in the essence of time, I won't share the agenda. It was all attached to your meeting, and I think you all know the drill now. We'll have 20 minutes of a presentation, then 20 minutes to discuss it, and then a couple of minutes just wrapping up. I do want to remind everyone, to stay muted, but also that we are recording this, and it will be posted to the IFISH website, which is also in your agenda as well. So you have that. And to not spend any more time, I want us to jump right in with Jeff and his team. We're very, very lucky today to have a presentation from Dr. Jeffery Levin and his team about improving crew overboard recovery in the Gulf of Mexico. And among many other roles, Jeff has spent the last 17 years doing very comprehensive safety and health work with commercial fishermen in the Gulf of Mexico. And I've asked if he could speak to his work and also to his team, because they're just amazing. So Jeff, over to you. And if you can go ahead and jump in.
Great. Well, thank you for that introduction, a very kind introduction. And I'm really appreciative that I and the Southwest Ag Center team can be a part of the International Commercial Fishing PFD Working Group, and are grateful to you, Rebecca, and to Dr. Sorensen, and now to Kim for helping us pull all of this together for today's presentation. So we're delighted about that. I'm going to go ahead and introduce the team members. And while I'm doing that, I'm going to ask Amanda Wickman if because we're gonna tag team on sharing our slide and screen and so forth today. So while she's pulling that up and sharing that, I'm going to go ahead and introduce the folks today. I do want to preface this by saying that I think everyone will recall that we had really a very excellent presentation about Crew Overboard in the last quarterly meeting. This presentation will be a little bit different. There are some aspects that are different in terms of the work that was done. And of course, the focus here is in the Gulf of Mexico. But I want to give kudos to the last presentation because it really was excellent, and it set the stage for us in terms of putting this presentation together for today. Amanda Wickman, who is part of this team, is program director for the Southwest Ag Center, and she has worked very closely with the center director and the core leaders and principal investigators and our advisory committee, really overseeing the administrative functions of our center. And for all the time she's been with the center now, for over 15 years, has been very engaged in the commercial fishing work that has been done for the center. The speaker who will be following me, Dr. Shannon Guillot-Wright, is newer to join our center, but she is not new to the world of commercial fishing at all. Dr. Guillot-Wright is the Sam and Elizabeth Nixon Professor of Family Medicine and Vice Chair of Research and Health Policy in the Department of Family Medicine at UTMB, or the University of Texas Medical Branch. Her background is that she has a PhD in medical humanities from UTMB, and she has served in a number of capacities with UTMB, including on the faculty of the School for Public and Population Health and the School of Nursing. Her research program really focuses on occupational health equity in the use of evidence in policy making, with an emphasis on structural violence and social justice. And she is now carrying those skills, an important background to the work that she is doing with our center, and in the future, we hope, with continuing to do with the Gulf of Mexico commercial fishermen. So I'm delighted that she's able to join us today. I just, by way of introduction, I think you've already mentioned my background in this. I do want everyone to know that I'm a physician by training originally. I'm an occupational medicine physician, but got interested in this work some 20 years ago now, and really have been so delighted to be able to work with this network of researchers and stakeholders in commercial fishing, as well as the many others that we've been able to nurture over the years in and around the Gulf of Mexico. So with that, I'm going to just talk a little bit about crew overboard recovery for commercial fishing in the Gulf of Mexico. Next slide, Amanda. I won't spend a lot of time on this, but I think, as we all know, our work is not done in a vacuum or by one person. It really takes a network and a team, and I am so grateful to all of the people that you see listed here, and then some and more, in terms of helping me with this work over the years and the most recent project that we embarked upon. Next slide. So this is not news to anyone. I'm going to frame this in the same way that we framed our last grant application, and you'll see here in the lower right-hand corner of my slide that this work has been supported through a cooperative agreement with NIOSH and the U.S. Coast Guard. But when we prepared that application, obviously we used the BNI, or the burden, need, and impact paradigm, to justify doing this work. And it's no mystery to anyone that I believe falls overboard are the leading cause of fatalities in the Gulf of Mexico shrimp fishery. And based upon common knowledge, I think, but also much of the work that we've been doing over several years, we recognize that there's a lack of culturally appropriate safety information for commercial fishermen in the Gulf of Mexico, because they are largely Asian Vietnamese. Now, that's not the entire Gulf of Mexico. That probably represents more of the western side of the Gulf of Mexico, but it is substantial, and it does represent a substantial demographic makeup for the shrimp fishery in particular in the Gulf of Mexico. We also know from the work of others and in the Gulf of Mexico that there's a significant need for recovering individuals who may go overboard. And I'll talk a little bit more about that, although we don't have a great deal of time to go into great depth about that. But and to understand some of the risks and prevention efforts that might come to bear on reducing the burden of deaths from falls overboard. And then finally, we hope that our work will improve the outcomes of crew overboard recovery. And part of that is dependent upon the development of culturally sensitive and hands-on training that we have previously demonstrated is both desirable and we believe effective for this particular demographic of commercial fishermen. Next slide. So the Northeast Center has really done a fabulous job of creating a drill down description of all of the elements that go into consideration of crew overboard recovery. And I'm not going to show their really very comprehensive graphic, which actually uses a nice life ring flotation device to talk about this, but this is a little bit of a simplified version just because I want to tell you where our research has focused. So this is what I refer to as the crew overboard chain of survival. It's a little bit modeled after the notion of a cardiac event survival chain, basically, in terms of how we deal with something that when it happens, we have to take steps rapidly in order to have a reasonable outcome from the causal or underlying causal event. So this chain of survival obviously starts with good outcomes that occur if somebody goes overboard, if they're wearing a PFD. And although that is not the primary focus of this research, I don't want to detract from that. That really is probably one of the most important first steps in anyone, for anyone in preventing a bad outcome from a crew overboard episode. Secondly, is identifying that someone has gone overboard and navigating to them in order to recover them quickly. Thirdly, to actually the mechanism for recovering them back aboard vessel. And in this instance, the mechanism that we are using, or the device that we are using, is a recovery sling that is very dependent upon the additional use of a mechanical advantage to successfully lift or hoist an individual out of the Gulf or out of the water back aboard vessel. Next slide. So our project aims were to distribute recovery slings, to conduct training with those recovery slings, and also to measure, in this instance, through survey data collection, the effectiveness of this distribution and training for reducing the risk of mortality from a crew overboard event. And that involved a series of surveys that were designed based upon a theory that we call the theory of planned action, that measures beliefs, attitudes, and confidence for the commercial fishermen to actually use this recovery device. Next slide. Well, suffice it to say, this is true for everyone. We started this project, we were approved to start this project in the fall of 2019. And so we were just getting ready to get started in around the turn of the year 2020. And yeah, you guessed it, COVID hit, and that really changed our research plan that was going to take place over the initial 2 years. So we had to shift from a proposal to have a dockside simulation initiative for training on recovery using the sling to what we refer to as a land-based training simulation. And you can see the elements of that land-based training simulation here. So we ended up using a tripod as our mechanical advantage, a mock-up railing to bring individuals back over aboard a vessel, and then a mannequin and the recovery sling, as you see here. Next slide. So our original plan in year one, starting in September, was to actually distribute slings, to do training, and to do a pre and post survey. And then in year two, to actually come back and make dockside visits to look at individuals' readiness for using the sling should a crew overboard event occur, roughly 6 to 12 months after the initial distribution and training. The pandemic forced us to revise our plan. And so you can see in the first 2 years, what we were able to accomplish was distribute and train individuals in the use of the recovery sling. And it wasn't until a third year, which was a no-cost extension in grant terms, essentially, to actually be able to do the follow-up that we intended. Unfortunately, because of a number of limitations, partly because of cost at that point, we could not do dockside actual follow-up. We ended up having to conduct our follow-up in a group setting. Next slide. This just illustrates some of the tools we had to use in the upper left-hand corner, because we were still operating in a pandemic. And the 3 sites that we chose to actually do our training initiatives, they from west to east began in Port Arthur, included Galveston. Those are the 2 Texas sites. And then extending into Abbeville, Louisiana, with our network of partners across these 3 areas. So the bottom right, I mean, there's no surprise. I mean, the illustrations speak for themselves here. The photographs speak for themselves, but I want to show you actually a little more of what we did in the still photograph in the lower right-hand corner, where we actually had a couple of our medical residents and U.S. Coast Guard, former U.S. Coast Guard individuals helping us with this initiative. But at this point, I'm going to ask Amanda to switch to a train the trainer video that we used. And so this is a silent video. So if you're not hearing anything, it's because it is a silent video. It's a silent movie. But we actually use this, again, because of limitations surrounding COVID, on how to go through the training and work with the commercial fishermen to use the sling and to use the mechanical advantage in order to hoist, an individual over the railing. Now, a number of limitations here, and again, I'm happy to address those later on. And a lot of questions that I'm sure are occurring in your mind about, how is somebody in the Gulf going to be putting the sling around them? Are they a comparable weight? Does the mannequin really reproduce this sort of setting, that sort of thing? So there are a number of limitations to this, but this was really probably the best and allowable from our IRB simulation training that we could actually do that was land-based in order to replicate what an individual may experience in trying to use the sling. So there is the video actually demonstrates a one-person effort. Sometimes this might actually be a one-person effort, but as you'll see, if you can kind of fast forward the video there, Amanda, the video also illustrates a two-person effort. And we won't go through the entire demonstration. Again, this is, we can certainly make this readily available to you, but the effort is to show, if you have one person, how might you do this? If you have two people, how might you do this? So we'll stop the video at this point in the interest of time and move back to the slides. And in the next slide, you will see that in phase one, we actually reached 123 fishermen distributing 119 slings, because we only distributed one sling per vessel in the 3 locations I previously mentioned. Fishermen were also given what we call a task list in order to take back to their vessels with their sling to offer them guidance, and they also received this during the training for mounting and maintaining the sling and conducting drills with the sling aboard vessel. Next slide. That task list actually became the substrate for an additional task questionnaire at our follow-up period, so that we could ask individuals to what extent they had done implementation, maintenance, drills, and so forth with the sling after they went back to their vessel. And this was modeled a little bit differently. Rather than using a Likert scale, we simply used a yes, no, did I do this task or did I not do this task? And of course, you can see that of necessity needed to be translated into Vietnamese. One additional point I'll mention here is, again, due to a number of limitations, we obviously wanted to go back to the same group. We were only able to do this with a subset of fish of the original 123 fishermen. So our N for the follow-up actually was 51 rather than 123, which also goes to a little bit of a limitation of the outcome of this study. Next slide. So findings, and I've just broken those into 2 parts here just to hit the high points. Our phase 1 demographics are relatively self-explanatory here. The 123 individuals were largely over the age of 49 years, predominantly male Asian. They elected to use the Vietnamese survey, most of them, to perform their surveys. And you can see their experience here, which we actually looked at some statistics relative to their experience and their years in the U.S. and the number of fishermen aboard their vessel in terms of the effect it may have as covariates with some of their behaviors and some of their confidence in using the sling. As it turns out, there was not a lot found that was statistically significant relative to those elements. We did also ask questions about those that had previously experienced a crew overboard event, which was a small subset of these individuals. Regarding our significant findings, and I'm going to hit the high points here, they are all tied more quantitatively to the survey that we did. So we administered a survey before the training, immediately after the training, and then roughly a year later when we did the follow-up, the group follow-up with the 51 individuals. Unfortunately, I don't have a great deal of time to talk about this today, but I used a construct, as I mentioned, called the theory of planned action here. And regarding their beliefs, the behavioral beliefs, the fishermen felt more strongly that it was important to wear a PFD aboard the boat between surveys 1 and 2 or immediately following the training. But that was really not sustained over time, interestingly. So it certainly told us that training, whether it's with PFDs or otherwise, offers encouragement for wearing a PFD, but like the device itself, it also wanes over time. And so constantly training and reminding the importance of use of PFDs is very important. Regarding normative beliefs, that's how others feel about it, that you consider opinion leaders, for instance, captains. There was a significant improvement over the 1-year time frame in the degree to which fishermen felt that maneuvering to the crew overboard was deemed important by the captain. An interesting finding, we're not sure why the training itself might be tied to that, but it was an observation that we made. And then finally, perhaps most importantly, was the issue of control beliefs, which is a surrogate measure for confidence. And essentially, the fishermen's control or confidence beliefs and their ability to use the sling to hoist the crew overboard waned over the 1-year period. They felt confident early on, but a year later, that confidence had waned. And again, it reiterates the importance of drilling and retraining in the use of a device in terms of crew overboard recovery. Finally, in terms of the construct we call intention, which is a composite result of the different types of beliefs in keeping with the theory of planned action. There was a statistically significant decline in intent to use PFDs over the 1-year period, as I mentioned earlier. And additionally, the intent to use the sling improved to a statistically significant degree immediately after the training and the dissemination of the slings, but there wasn't a statistically significant further improvement or decline over the 1-year period. So our conclusion from all of this is that these beliefs wane over time, these intentions wane over time, and it emphasizes the importance of repeated training and survival drills in this industry. Next slide. So there were a number of qualitative impacts here, but I want to give Shannon enough time to speak. Good visibility with the fishermen and a number of our partner stakeholders. A lot of increased trust in improving our relationship with the fishing communities. Community champions were identified, as they always are, in research efforts like this. We developed some new collaborations that we'd not had previously. We were able to engage our occupational medicine residents in this experience, and I'm happy to say that 2 of them over this period of time are co-authoring a paper, which we hope will be soon accepted and in publication in short order, with sustained engagement with the U.S. Coast Guard, which we have found to be very important for our efforts. And again, the ability to develop culturally appropriate training tools, at least for this demographic. Next slide. So with that, we'll take questions a little bit later on in our discussion, but I'm going to turn the mic over to Shannon for her portion of the presentation.
Thanks so much. So I can run through this pretty quickly, I think. And what this really is taking what you just heard Jeff talk about and kind of thinking about where are we now with PFDs and where fishermen are in their thoughts and values on wearing them. And so what we did is we worked with the Ag Center, and we did a 2-year project where we were working in some of the same areas in Galveston, as well as we had a different site in the Rio Grande Valley in Texas. And we were doing, and you kind of saw a little bit of this in the last slide, community-based participatory research. And so what that really means is trying to understand what is it that the fishermen are wanting or needing, and then how can we engage in that way. So it's a little bit of a different model of research. I think it's becoming a little bit more standard over the last decade or so, but really that relational model and trying to engage communities throughout the entire process. So from forming the research question all the way to how do we actually move into practice with these communities. Next slide. So what we did is we engaged with, again, in Galveston, mainly Vietnamese fishermen. We had semi-structured interviews. So that means, having an interview guide and then, allowing, the different participants to kind of add and insert their own thoughts and feelings into that. And then we also had one focus group with participants, and then we did photo voice with them. We tried to do photo voice in both locations in the Rio Grande Valley and in Galveston. And in Galveston is the only place we were able to get those cameras returned, which I think also goes back to that relational model. So we're located in Galveston. We get to build much deeper relationships with that community. And therefore, we're able to get some of those cameras back a little bit easier. And then also important to this work was observation. So what we did is my research program manager, Lacey Davis, who is a star and absolutely amazing in this work, her and I really just started by sitting out on the docks. We had our 2 academy chairs that we would pop out, and we just sit there and observe what was going on, get to know a lot of the guys, a lot of the different dock workers, some of the managers, the Coast Guard, and really try to engage with the community in that way first, and before then jumping into the research. Next slide. And so what we really found through this is, and what we were looking at as well, was like the social determinants of health, or the structural determinants of health. So structural, we're talking about political, economic conditions. So we were able to try to understand, the price of shrimp imports and how that was impacting, the daily lives of the guys that we were working with, as well as diesel prices. So this, took place, between 2020 and 2022. And so, we had some pretty high inflation with diesel prices during that time. And then there's social worlds, or those social determinants of health. So there we're looking at the cultural and interpersonal. So what are their family values? What's their connection to their family? Do they get to see their family often? And how are they engaging with coworkers? So that was really how we were kind of thinking about this work. Next slide. And so the results that we had, so we, this is actually a photo that one of our participants took for us. And we had about 30% of the fishermen we worked with had unstable housing. So many of them lived at the docks. Most were male, and then in Southeast Texas, Galveston, Vietnamese, and then in the Rio Grande Valley, Latino. And what we saw was a lot of thoughts about safety and danger, and understanding that danger, access to healthcare, and mental health. And this was within the realm of slips, trips, and falls, and examining that with these Gulf of Mexico fishermen. Next slide. I'm going to run through these results kind of quickly, but the way that these are presented is really through the words of the fishermen. And so first, danger and understanding of danger, knowing the risk of the job, but really seeing it as unavoidable or inherent to the work. Next slide. So this person told us, we never told anybody, but so many people die. So today I'm going to tell you, so many people died because of these hazards. Nothing is safe here. We then followed up, so are you wearing a flotation device? And they said, we can't work with it. It's hard to work with wearing one. Next slide. This person, a captain in the Rio Grande Valley, told us all jobs have risks. This one is just a lot more, but this is the type of jobs the majority of immigrants have to get. That's just the way it is. We asked again, earlier, you said that you have to climb out. You hurt your finger. Were you wearing a life jacket? No, we don't use them. You can't do the maneuver. So we heard this. You can go to the next slide. Kind of again and again. Again, do you wear a life jacket? No, there's nothing we can do in those. This person told us a lot of us only speak a little English. We don't understand the technology. If there's a device that could help us, we don't know how to work it. So that was a deckhand who spoke mainly Spanish. Next slide. Next, we were looking at access to healthcare. So what we found was that little, if any, access to healthcare in the U.S. Were kind of prominent among the shrimpers. So in the Rio Grande Valley, many of them talked about just going over the border to Mexico because it was a lot cheaper, and that's how they would get primary care. In Southeast Texas, most people neglected care entirely. Next slide. So here we asked someone, are there any things that help when you get sick? Is there anything besides the Coast Guard? And the interviewee said Bud Light. So, this is something that we all kind of chuckled about and he was laughing about, but in many of our photos and videos that we've produced with some of the fishermen, you do see alcohol everywhere. And that also has a connection to slips, trips, and falls. When we would ask, some of the fishermen, if a coworker, fell overboard, what was typically happening. And many times we would hear that they'd been drinking on board. So although said lightheartedly, it also, was very pointed towards some of the larger issues that we were looking at. Next slide. This person said, I lost all my teeth in a crash. My nose was cut open. I didn't call the Coast Guard because basically he needed the money. So he put up with the pain. The captain wanted him to call the Coast Guard. So the captain was looking out for this shrimper, but he just used pills for pain and infection so that he could keep going. Next slide. This person said that talking about the shrimpers, that they make a lot of money, but one thing, they don't have any IDs, they've lost them, they don't have a car, they don't have a transportation. And this was in the context of wanting us to help find some housing for some of the unhoused shrimpers that we were working with. Next slide. And then last, mental health. So what we saw with this was really mental health issues stemming from loneliness, from past trauma, again, limited access to housing or health care. And rarely did we have somebody, flat out say something like, I would like help with, my behavioral health issues. But it was really in what they were saying that we could, start to understand this better. Next slide. So this person talked about when his wife passed away and he was upset and drinking alone at home. He looked around and he found the alcohol and he did it, basically giving a middle finger to the world. This other shrimper told us it's different for us because the majority of time we're surrounded by and out in the water. It's as if you were in jail. Next slide. And then this person was talking about missing a finger. I thought in context that it was to do with fishing, and he said no, when he was young, his father chopped it off basically as a form of punishment for him getting drunk. So you also saw this sort of past trauma that they had, and some of that trauma also, many of these Vietnamese refugees came over as children or young adults, and so even wartime trauma, as part of that as well. Next slide. And then here again, we have, someone talking about how difficult it is being out at the water for such a long time. He said, the Americans say you're homesick because we don't see our kids, we don't see our wives, and it really hurts. And then this person talked about, for his son, whenever he has to say goodbye, he starts crying. He was 6 years old. It's tough all your life at sea, not seeing the kids grow up or anything. Next slide. So kind of what does this mean, right, to PFDs? And that's sometimes the big question. And what does it mean to slips, trips, and falls and that prevention of slips, trips, and falls? And so what we really saw throughout this work was that many of the fishermen and the shrimpers were not going to wear a PFD. They basically flat out told us that, and for a variety of reasons. And we were interested in one, some of those underlying reasons, and then two, how could we move the needle? And so time and time again, what we heard was this issue about access to healthcare, especially within Southeast Texas. And so kind of following the community-based participatory research model, we implemented what was a dockside clinic. It was supposed to be a one-time clinic that we implemented to provide health and social services for the fishermen. And this was really as a way, thinking of Maslow's hierarchy of needs, that I can't necessarily ask a shrimper to wear a PFD if that person doesn't even have housing, doesn't have, primary care, is, having health issues. And so something like, an abstract event like falling overboard, even though they understand the danger and that they've seen other people where it's happened, in order to move that conversation forward, there also had to be something where we were actually providing something concrete that the shrimpers were wanting as a way to then keep up that conversation. Next slide. So this is our team that we worked with, so many amazing people. We have Crystal, who is the manager, and I can't go through everyone because I know we're already over time, but I really wanted to say thank you to them as well. Many of the Galveston Seafair Center, physicians who volunteered, students at Texas and Louisiana Sea Grant. Next slide. And then the funding support for this was through the Southwest Center for Agricultural Health, Injury Prevention, and Education, through the cooperative agreement. And then for the implementation side of the clinic, we were able to fund that through a COVID outreach agreement that we had. And so that clinic, I'm going to put a link to a video that talks more in depth about that clinic, and then really where we want to go. We have support to do 5 years of then, taking that and implementing it on a larger scale and being able to see how that type of work can increase the use of PFDs or prevent slips, trips, and falls. Next slide. I think that's it. Yep. Sorry for rushing through that, but thank you all, and always happy to talk offline as well.
It was wonderful. Thank you. Can you stop sharing your screen and then we'll get the whole panel back. So now's our chance to see what questions people have. That was just really fantastic. You can go ahead and just unmute or raise your hand, whatever you're more comfortable with. You guys did such a good job. Everyone's sitting there thinking, what are they going to do next? So, well, I'd love to hear a little more from you guys about when you talked about the PFD use increased briefly during the training and that declined over time, but that the sling went up and it sounded like that stayed up, if I remember correctly. What do you think the difference was between one going down with time and the other one actually increasing or staying active? How would anyone explain why those were different?
Yeah, actually, I hope I didn't state this in a way that was misleading. So between the first and second survey, it was clear that beliefs were that it was important to wear a PFD. And they also had greater confidence in using the sling. So those they're sort of two different constructs. One is a belief in importance, and one is the ability to use it. But by the time we got to the third survey, which was identical almost a year later, both of those had effectively waned, both the belief in using PFDs and the confidence in using the Crew Overboard recovery sling. So, you know, there are a lot of limitations in reaching a conclusion about that, but the fundamental conclusion is that, you know, when you are right then and there, talk about the importance of wearing a PFD, everybody seems to believe that, yes, you know, their belief in the use of PFDs goes up. And so, you know, one might assume, well, gosh, if something happened the next day, maybe you would find that they're wearing their PFDs the next day. But by a year later, no one seemed to really believe that. So the point being, you can't just tell them once that they need to wear a PFD, right? You got to keep at it. And as Shannon said, you also have to address other needs first so that they actually will believe that it's important to do this. To move the needle on these things we think are life-saving really means we need to address these other issues first. But the same is true with confidence in using the Crew Overboard recovery sling. You know, right afterwards, no problem. You showed me how to use it. I think I can do this. I'm willing to do it. I intend to do it. But by a year later, that intention had not improved, and their confidence in doing it had certainly waned.
Thank you for clarifying that. That was well described. And Shannon, what you described as all the other challenges they already have that have to be met first are really true, I think, for all of us to keep remembering. I did want to ask if you had looked at what they had for a recovery device or a reboarding device before you started. Was there a baseline of what they already had on board, and did everybody have some sort of system, or did you find big gaps in that then when you introduced the sling, that was sort of new for them?
My perception, so first of all, we didn't ask any specific questions about that, and we did not make a formal assessment of their individual vessels at the time that they came to the training and they were given the slings. So I'm not sure I know the answer to that. Qualitatively, I might ask Amanda if she has any sense of that, honestly. There are clearly other devices, you know, ladder kinds of devices. There are other kinds of devices for actually recovering individuals from the water and helping them reboard the vessel. But I don't know that we formally asked what they actually had available to them.
It's a requirement. It's a U.S. Coast Guard requirement that they have a life ring on board. I believe they have to have 2 recovery devices. And one of the regulations states that they can actually replace a life ring with a life sling. So that was one reason why it was such a beneficial incentive for the training, because it met one of the requirements to help them stay within compliance with the U.S. Coast Guard. So, and the benefit of a sling over a ring, according to our U.S. Coast Guard partners, is that the life ring is hard. And when you put a person in the ring, assuming that they're small enough to fit in it, which is not always the case, that is not a comfortable thing to be able to hoist someone with, even using a mechanical advantage, and pull them back over out of the water over onto the deck. And the life sling is really designed better so that a person of many sizes can get the sling on, and then it's comfortable and malleable, and it can mold around them as they're lifted and reboarded. So it helps them to meet the requirement. The other things that they have on board eventually do wear out, especially with all of the elements at sea. So this helps them to stay in compliance. It provides something that they would have had to buy for their vessel anyway. And it's also a better piece of equipment for reboarding.
Thank you, Amanda. Ann, I see your hand is up.
Yes, thank you, Becca. Thanks, Jeff and Shannon. Those are great reports, and it's impressive to have the social determinants of health worked in here. Really, really great work. So I know from working in the Rio Grande area myself, but not with the fishermen, that there is federally qualified clinic. So for both you, Jeff and Shannon, I was wondering if you had reached out to the federally qualified clinics in your region to see how they could help. And I know that in Nuestra Clínica del Valle, there are community health workers there whom we actually trained and who could be helpful, I think, in reaching out to the fishermen. So I'll leave it at that.
That's a wonderful question. So in the Rio Grande Valley, I'll say yes for both. We have reached out to the FQHCs. In the Rio Grande Valley, the executive director, and I'm blanking on that huge, because they have a pretty robust federally qualified health center group, said that a lot of the fishermen don't qualify because of some specific policies around, even though they're considered ag, within like this FQHC policy, they weren't being considered ag workers, and so they couldn't get reimbursements. And so it's a policy she's actually been working on for decades to try to change. And so that was one issue that we had there. In Galveston, the St. Vincent's is one of our FQHCs, and they are one of our partners in the Dockside Clinic. And then for the 5-year project that I just kind of briefly mentioned, and that is one thing that we're trying to do in each community, is to work with the local health agencies so that it's a much more sustainable model, and bringing in like the health navigator model and community health worker model. I saw someone from Fishing Partnership on here earlier, I think, and we've been talking with them a lot about the health navigator model and how to implement that. So it's a really great question, and I think we definitely can do more of it, but we have been trying to engage in that way.
I will say, I think that's a great response, Shannon. I will say, Ann,
great.
That is an outstanding point. Here from Tyler, we've had, and I know this is true of Galveston also, we've had a number of different kinds of programs working with community health workers, including Nuestra Clínica, but the focus has never specifically been on training community health workers related to occupational safety and health in commercial fishing. So I think you've given us a great idea, because I don't know that we really tapped into that resource of community health workers as the spokesperson for using life-saving tools in the commercial fishing industry in underrepresented groups like the border region, or for the Vietnamese but as well. So that's a terrific idea.
So just to follow up on that, if I may, Becca, my group has developed an occupational safety and health training for community health workers, mainly because they do not, I'll try to be quick, they don't get any occupational safety and health training as part of their certification. And in Texas, you have a very robust certification for CHW program, but it doesn't include any occupational safety and health. Sorry. So we did that to not only keep them safe, but to others there are with their clients' workplace. And so I think I'm happy to talk to you some more, Jeff, about that curriculum, and Shannon about, how I also in the Northeast can pull some of your ideas into what I'm doing. So thank you.
Yeah,
I'm going
thank
to jump in real fast and just say I would love to talk to you because we actually just applied for a grant that we hope that we'll get funding for that would be using community health workers specifically throughout some of these regions to target like substance use among commercial fishermen. And I think we have the training built into the grant, but including that would be absolutely wonderful. So we should definitely talk offline.
Thanks.
And John, I see your hand is up. We have reached time. Is it a very quick question or?
It is a very quick question. I was just interested that lots of the 123 fishermen, that many of them are adamant that PFDs weren't going to do them any good. So and also the constant reminder about wearing PFDs and the drills and the retraining that's so important. But also the health, the loneliness. We don't see our kids and our wives, and I think that's probably something that we probably don't do enough of. The social sustainability. Yeah, thank you.
Nicely said, John. Thank you. Yes, I think so many things you've raised in this talk are really relevant to all the work everyone is doing. So thank you all for presenting today. Really appreciate it. The video will be posted soon. And Anne, could you send out to the whole mailing list the information that you were referencing, and people should share anything that they think is useful to the group as well. So that is a resource for people to share ideas. And just want to thank everybody for being part of this today. And we will see you at the next quarterly meeting. So thank you very much, Jeff and Shannon.